Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental of Springfield in Springfield, Virginia. Today I want to talk to you a little bit about my aftercare instructions for All on X. So an All on X is when we take out your remaining teeth, if there are any, place about 4 to 6 implants per arch, and then affix a denture to those implants that day. So the day of surgery, you're going to be very numb. You're going to be a little groggy from the anesthesia. We always do a 24-hour check for the bite. So when you're a little more alert and awake, we'll check the bite, go over post-care instructions again. So at the 24-hour check, I'll check the bite on the denture. In the temporary denture, that's usually acrylic or printed resin, you don't want to eat anything you can't cut with a cheap fork and knife. So that's kind of my generic go-to. So you don't have to be a liquid diet, but kind of a softer diet. So, steak is fine if it's medium rare, but burgers are fine. There's a lot of foods that are fine, but I wouldn't get like a big old sub sandwich that's really crunchy and just try to munch on that. I'd avoid nuts, things like that, things that are really hard and crunchy I would avoid. So if it's soft enough to cut it with kind of a cheap fork and knife, plastic fork and knife, go for it. That's kind of my go-to. Really hard foods, you want to wait till your final. We'll do your final typically about 4 months after surgery. Your final will typically be on a zirconia, so you can pretty much do whatever you want with that. With that, we do want you to have a guard. Everyone clenches and grinds their teeth a little bit, and the zirconia is gonna chip the porcelain at some point. If you can't tolerate a guard, what I'll usually do is keep one arch in zirconia and one arch in acrylic, so that we intentionally wear down one arch over the other. But I do recommend a guard for all my All on X cases for the final. The initial prosthesis, it's going to feel bulky. It's going to take time to get used to. It's going to be a phonetic adaptation. Anytime we're doing anything that changes the way air goes through the mouth, whether it's a cosmetic rehabilitation or dentures, it's going to change your speech a little bit. So if you read out loud to yourself 15 minutes per night, every night before you go to bed for 15 minutes, that helps you adapt more quickly. In 2 or 3 weeks, you will have adapted to the speech of it, and it'll be fine. So the first couple weeks of healing are the worst. That's when the tissue's healing, and you kind of have to be careful around the stitches. You will have a lot of stitches in there. They will be resorbable, so we don't have to cut them out. I do use a nicer, longer resorbable suture. It's going to take a couple weeks for it to resorb. It's usually purple, sometimes it's white. You might see little pieces coming out. That's fine. You do want to clean under it gently, so I would give it a couple days before you do any vigorous swishing. Then at past day 5, I would start swishing more vigorously. And then past that, as long as it's not uncomfortable, we'll give you a little irrigating syringe to start irrigating under it. And about 3 weeks, the tissue should be pretty healed up, and you should be able to clean thoroughly under there with a water pick. You do need to brush the denture. You don't need to have toothpaste on your toothbrush. You can if you want, but you do need to brush all of the denture, because plaque is going to build up on the denture and it's going to affect the healing of the implants. So you do want to brush the denture. You want to clean the denture. We don't want a white layer of bacteria on the denture around the implants. And as the tissue heals under the denture, it's going to shrink. And as it shrinks, there's going to be a bigger void under there, and food's going to get caught in there. So you definitely want to get a water pick, both for the temporary and the final. You just don't want to blast under there super hard right after surgery. So about 3 weeks, the tissue's going to be nice and healed. It's going to be pretty safe to blast under there fairly aggressively with a water pick. You do want to water pick out all the food. And when we do your final, we're gonna line it back down to the height of the tissue, so you won't really have stuff getting caught as much in there anymore. We try to make it so it's easy to clean underneath, and if that's the case, then we don't really need to take it out to clean it. If we can't do that and there's kind of like a saddle over the arch, we might occasionally take it out to clean it. We try to avoid that to make it easier for you and for us to clean, so we're not having to take it in and out all the time. But you do want to get your implants and your permanent denture cleaned the same way as you would your teeth. So they can't get cavities, because there's no teeth in there to get cavity anymore, but they can get gum disease. So if you've had an issue with gum disease before, we might have you on a 3 or 4 month maintenance. If you haven't, or you don't build tartar quickly, it might be 6 or maybe even 9 or 12. So we'll let you know what we need to see you on, but we'll start you on the shorter maintenance and extend it out over time, because we don't want tartar to get on the implant and get down under the gum and negatively impact the bone around the implant. I typically do a digital workflow or something called the triple J. Saves us time from converting your temporary to your final. So about 4 months, or after all the implants have healed, if there's any changes, of course, if you want to change the teeth, change the color, change anything in any way, we can certainly do that. But we'll transition from your temporary to your final. So as you're getting closer to 4-month mark, be critical about what you want changed. Other than that food gap, of course, we're going to fix that. But if you want the color change, size or shape of the teeth change, that's the time to do that. So we'll take it out, test all the implants, scan. There's something cool called photogrammetry extraoral scanner. There's cool ways to scan in the mouth too. A lot of cool scanning techniques now are mostly digital now. We'll scan that, or we'll use the model from surgery to convert your temporary into your final. So you'll never be without something that's screwed in. The only exception to that would be if implants fail or if we can't immediately load the denture. We always try to immediately load the denture. I can't guarantee it. Everyone's bone is different. Different people have different infection around certain teeth, different anatomical structures. I need at least 4 implants to go into a certain level of tightness to be able to immediately load your denture. So that's always our goal. If you lose an implant while you're healing, we might need to convert you to a regular denture. Again, it's rare. It happens. The number one cause of failure in implants is diabetes. So if you're a diabetic, I would expect at least one of your implants to fail, and we can replace it, and that may or may not affect your timeline or the final prosthesis depending on where and when you lose the implant. So sometimes we'll bury additional implants the day of surgery and uncover them later. Sometimes the same implants you have at the beginning are the ones you have at the end. Sometimes we have to take one out or add one or things like that. So these are all options. It's not going to impact your long-term outcome. It might add separate steps in the interim. Don't worry about it. Your final is going to be just as good and the same. If we have to add separate additional steps, we try and avoid that. But if we need to, we will. We'll get it taken care of for you. We'll get you a nice final. That's the ultimate goal, is to get you a nice final. If you have any pain, swelling, discomfort, infection, anything like that around the prosthesis that's healing, let us know. But the important thing for you is to be gentle with it the first little bit after surgery. But after that, really aggressively clean that thing. You can't over clean it. We need that thing clean so the tissue can heal, the implants can heal, and we can get you to your final. If you chip or break a tooth off the plastic, let me know, we'll fix it. But your main job is to keep it clean and work with home care. And then I'll worry about all the technical stuff and the implants and the integration and the final and all that. Pretty much everyone clenches and grinds their teeth at night a little bit. We will definitely get you a guard in the final. I've had patients that have chipped or broken acrylic or aggressively grind in their temporary. So we might on occasion need to do that in your temporary as well. If you have any questions, please call the office 703-451-4500. My cell phone's on the post-op sheet, 616-340-7674. Thanks, and enjoy your new teeth.